This lecture is on communicable diseases that are caused by parasites. This lecture lasts longer than the other lectures that you've watched because there's no clear space to stop and create more than one lecture. However, feel free to stop the presentation at any time and come back to it later when it's more convenient for you to watch. If you choose to stop the presentation and come back later, please make note of the minute and seconds where you are in the presentation so you don't have to rewatch material that you've already seen. So here's a definition of what parasites are. They're organisms that live on another organism like a host. They get their nutritional needs met through the other organism, and that nutritional needs that they get met can actually be in detriment to the host organism. Parasites live part of their lives outside the host organism, and they've evolved into complex organisms with systems inside them that are similar to human systems. So when we're talking about parasites, realize that they often have digestive, respiratory, reproductive, circulatory, etc. systems within their cellular structure. These are the ways that parasites are spread. They're spread through contaminated food or water, and this could be that the parasites are living in the food or water and it's not cleaned correctly or cooked correctly. It could be through fecal-oral contamination, which means someone has fecal contaminants on their hands and then touches someone's face or their own face, and the parasites spread that way. It's spread through blood and vectors like Lyme disease and ticks, and it's spread through sexual fluids, which we'll look at a specific example later in the slides. There are three main types of parasites we're going to look at in this slideshow. It's protozoa, helminths, and ectoparasites. So protozoa means little animal, and these are the types of protozoa that will be reviewed. There are sarcodina, flagellates, ciliates, and apicomplexans. Sarcodina are amoeba-type elements. They have the shape-shifting format of amoebas. Most of you have seen this in slides or videos. They're pseudopods, which means they can engulf or latch onto their prey. The different types are entamoeba, Naegleria, and acanthamoeba. Here's an example of a sarcodina parasite, and it's called entamoeba, which causes amoebic dysentery, which is an intestinal disease. It's caused by poor sanitation, food or water that's contaminated with stool. Sometimes countries or areas use human waste as a fertilizer, which is problematic. The signs and symptoms are listed there. The diagnostic blood test, sigmoidoscopy or stool test, or even a microscopic exam of the stool. It's treated with antibiotics or IV, but antidiarrheal medications are not given for this. The prognosis, it lasts about 2 weeks, and the prognosis is very good with treatment. And if you're traveling to other countries, the prevention is to avoid water or fruits and vegetables that you eat the skin. For example, a fruit that you eat the skin is an apple. A fruit that you do not eat the skin is a banana or an orange. And ice, because it's water, frozen water, you also need to avoid ice as well. Here's a second type of sarcodina, and that's Naegleria. And this is the cause of encephalitis. This is a brain-eating parasite. It's contaminated. It spreads through contaminated water through the nose, and it travels to the brain. And this occurs when people are swimming in warm, freshwater places like lakes and rivers or incorrectly managed pools and spas. The signs and symptoms, there's 2 stages. The first one is fever, nausea, vomiting, and the second one is the stiff neck and seizures and coma. The diagnostic is based on a discussion of behaviors and examine of the spinal fluid. The treatment, it's important that swift treatment helps. Recovery is rare from this, and this is not a disease that's typically found in the United States. It's often found in other countries. Prognosis, there's only 4 known survivors according to the CDC, and the prevention is to avoid swimming where water can be contaminated and make sure that pools and spas have proper care and they're maintaining correct chemical levels. The next type of sarcodina is acanthamoeba, and this is an example of a corneal infection. Most people are exposed to this parasite in their lifetime, but very few become ill. It's caused with incorrect handling of contact lenses, not disinfecting them correctly, or being in a tub or swimming area with contact lenses in. It does not spread from person to person. There's no direct contact spread. The signs and symptoms are listed there. The diagnosis occurs with an eye exam or a sample to discharge or a microscopic exam of the discharge. The treatment, it just depends on various eye medications. The prognosis is very good with proper treatment, and the prevention is very easy. You just avoid improper care of lens or doing certain things with the lenses in. The next type of protozoa parasite that we're going to look at is flagellates. And flagellates are vase-shaped, and there's a diagram on the slide that shows you that they're oblong. Flagellates are rarely pathogenic, and these are the different types of flagellates. Giardia causes intestinal disease, Trichomonas causes vaginal and urethral disease, and Trypanosoma causes blood and neural disease. And these are some examples of what flagellates might do. So here's an example of a flagellate. This causes it's most frequently diagnosed in the U.S. It's caused by poor sanitation, mostly by drinking water that's contaminated or being in recreational water. It's found on food, soil that's contaminated by infected animals. It has an outer shell and it lives relatively long outside the person. It can pass directly person to person or animal to person, and it's sometimes spread through oral or anal intercourse. These are the signs and symptoms. Again, it's an intestinal issue. The diagnosis, you have to do 3 stool samples that show that it's present or fecal immunoassays. The treatment is flagell drugs. If someone's pregnant, they use different drugs. They use antibiotics. The prognosis is that most people respond very well to the treatment, and the prevention is to make sure hands are washed correctly. Don't swim if you have diarrhea, and minimize contact with animal feces, and the other prevention strategies are listed there as well. Here's another one, and this is the Trichomonas vaginalis, or it causes trichomoniasis. This occurs with unprotected sex with infected people. The signs and symptoms, 70% of the people have no signs or symptoms. And if they do occur, there's an irritation at an entry point. There might be burning at urination. And there's a thin discharge that's clear, white, yellow, or green. And there might be discomfort during sex. The diagnosis is through physical exam and lab tests. It's treated with flagell drugs, but all sex partners must be treated with flagell or it can come back. It responds very well to treatment, so the prognosis is very good. And the prevention is to practice safer sex with latex barriers, limit sex partners, and avoid sex if you think you are infected. Here's another one, an example, and this is what causes sleeping disease, and it's spread from the tsetse fly to mammals. So what happens is the signs and symptoms are a chancre at the site of inoculation. So wherever the tsetse fly bites the mammal, there'll be a chancre at that site. There's then fever, lymph nodes swell, headaches, and then there's an increase in sleep patterns till eventually the person goes into a coma. It's diagnosed through microscopic exam of the blood and or the central spinal fluid. The treatment works well if it's in the early stages. Prognosis, people do respond to the treatment, but death can occur if the person is not in treatment early enough. And the prevention is to control the insect vector. So that's one of the ways to prevent the spread of the disease. At this point, we're going to move on to ciliates. And ciliates are highly complex cells. It gives you the side, and there's a photograph of some ciliates. The reason they're called ciliates is they're covered in cilia, and the cilia is what helps them move. Here's an example of a ciliate that's a parasite, and it causes balantiasis. It's very large. It's an intestinal disease. It causes dysentery, which is diarrhea. It comes from eating contaminated food or drinking contaminated water. It lives in pigs or rodents and non-human intestines. So that would be the reservoir. The signs and symptoms, again, are all of the intestinal issues. The diagnosis occurs through stool samples or tissue samples taken during an endoscopy. It's treated with tetracycline or flagyl, responds very well to treatment, and the prevention is to avoid feces or contaminated food water. So again, it has to do with preparing food correctly and making sure that feces are not used to fertilize food. Here is an apicomplexan, and we're going to talk about that. It's sporozoa. These are also highly complex cells, and many of these are pathogenic. They alternate between sexual and asexual reproduction, and they also might resemble bacteria or fungi. And some examples of how these might spread are Toxoplasma or Isopora. Here is an example of an apicomplexan, and it was toxoplasmosis. And you can see that almost 0.25% of the people over 12 in the United States are infected with this parasite. It's foodborne from animal to human. It's foodborne. It can be animal to human, mother to child, or blood transfusion or organ transplant. For foodborne, it comes from undercooked pork, lamb, venison, chicken, or other meats. In animal to human, it's because of cat feces. And so if people have a cat, this is a parasite that lives within their feces, so if you're cleaning the litter or you allow your cat or other people's cats go to the bathroom in your gardens, you could actually contact the disease through that. It moves from mother to child, newly infected, or fetus to embryo. It's severe, causes nervous system damage, miscarriage, and this is often why pregnant women are told not to clean the kitty litter box. And it also can occur during an organ transplant or a blood transfusion, but that's very rare. Signs and symptoms, one of the issues is there's very few signs or symptoms, and when there are things like flu-like symptoms or swollen lymph nodes and muscle aches. The diagnostic is there. The treatment, healthy people need no treatment. Immunocompromised people do need medications for their entire life, and some of the drugs are listed there. The prognosis is very good for healthy people, and the prevention is to make sure you wash your hands correctly after gardening or working with cat litter. Make sure you eat fully cooked meat, avoid untreated water, or make sure you cover your sandboxes, because also cats will go to the bathroom in a sandbox if it's left open. Here's another example, and this is most common in tropical and subtropical areas. It comes from contaminated food and water, causes watery diarrhea, and you can go through and see these. They're all very similar. The parasites are all similar in the kind of symptoms they cause. The diagnoses are similar. Treatments are similar, and prevention is pretty similar also. So those are all important areas to realize that by washing your hands correctly, avoiding infected fruits and vegetables or water or ice, typically you're not going to get these type of parasites. The next type of parasite we're going to look at is helminths, and these are large multicellular organisms, and they're worm-like parasites, and they're visible in their adult stages. So when a helminth is in its adult stage, you can actually see it with a naked eye. They're free-living or parasitic. They're hermaphroditic, and that means they're bisexual. They have both male and female sex organs, but they do not multiply inside humans. They're grouped by the morphology of their egg, larval, and adult stages. So these are the three different types of helminths. There's flukes, there are thorny-headed worms, and there are roundworms. And we're going to now look at some examples of each one of those. So here are what flukes look like. One of the examples it's given is tapeworms. So there's three types of trematodes, and these are what they are. They're typically, monogenea is typically found in external parasites of fish. The next one, these are endoparasites, which means they live within something. And Digenia, these are endoparasites with similar adhesive organisms and life cycles that involve an intermediate host, which means they have an indirect life cycle. And we'll look at some examples now. Trematodes or flukes typically are related to blood, liver, pancreatic, lung, and intestinal issues. They're from various geographical areas, and you can see where they're most prevalent. The hosts are listed. It's mostly mammals, and rodents would typically carry, there could be a host, but also humans, dogs, other mammals are there. It's an intermediate host is freshwater snails and aquatic snails and amphibian snails. So while the final host are the mammals, there is an intermediate host, which is they're listed there. They're transmitted through these shellfishes or freshwater fishes or aquatic vegetation. The signs and symptoms are there, and you see the one thing is the swimmer's itch, which is a dermatitis. And there's other places that you can have this disease. So if it enters your urinary tract or your intestinal system, you see the signs and symptoms change. The diagnosis is the geographic history of where you've been or finding the ova of the helminth in your feces or other body fluids. There is a treatment that works very well, and the prevention is to make sure you avoid contaminated food or water. Here's an example of a cestode, which is a tapeworm, and these are flat, they have flat ribbon-like bodies, and they have no alimentary canal. The host is a human GI tract. They also have an intermediate host, which is human feces or crustaceans or fish that are undercooked. They are also transmitted via rodents and fish. They have very specific signs and symptoms: pernicious anemia, B12 deficiency, pain, diarrhea, or actually an intestinal obstruction. It's diagnosed through finding the ova of the helminth in the feces. The treatment is there, and the prevention is to make sure that meat is fully cooked. Pork and beef is inspected through a place like the FDA, and to avoid contaminated water. The next one we have is in helminth is the thorny-headed worm, and here's an example of one of those. And these have complex life cycles with at least 2 hosts. They're transmitted in pig and other hoofed animal intestines, and the signs are enteritis, gastritis, and GI infection. So again, all intestinal issues. And an important issue for these is they do not reproduce in humans. The next helminth is a roundworm, and these are called nematodes, and they're found in the GI tract, the blood, the lymph system, or subcutaneous tissues. They're found mostly in temperate and tropical climates. It's a very small number of worms. If you have a small number, you'll have no symptoms, but as the worms increase, you will develop symptoms like wheezing, coughing, etc. The diagnostics for this are microscopic examination of stool for worms. Treatment is chemotherapeutic drugs are very helpful, and the prevention is to avoid human feces, dispose of human feces correctly, and to have good hygiene. So now we're moving on to parasites that are ectoparasites, and these are organisms that live outside the host. They are blood-sucking, and they can attach for hours, weeks, or months. And I think everyone is aware of some of the ectoparasites and some of the diseases, but here are some examples. They're typically spread by pets or by someone who has them. They can be spread through sexual contact, and sometimes they're spread by outdoor activities because they live in soil or they live in the grass. So one example is arthropods, which is insects. So you have fleas, which have been known to spread the bubonic plague. Mosquitoes spread malaria, West Nile virus, and encephalitis. Ticks spread Rocky Mountain spotted fever and Lyme disease. Mites can cause scabies. Lice, there's no major disease or issue. They're very uncomfortable, but there's no major disease associated with them. Sandflies cause leishmaniasis. And midges are deer-vectored, and they cause episodic hemorrhagic disorder. And so these are just some examples of ectoparasites, and these are parasites which live outside the host and suck blood, and the blood sucking is how the parasite is spread. So in summary, parasites fall into three main categories. They're either protozoa, a helminth, or an ectoparasite. And within this slideshow, we went over examples of each one of those. And another summary point is they're typically spread through food or water that is not well maintained or is contaminated. They can be spread through blood or organ transfers, and they can also be spread by sexual contact. So that concludes the presentation on parasites. There's another presentation to watch on a different topic. Once you watch both slideshows, you are then ready to move on to your online assignment.